I'm Shanker Pasupathy. I'm a gastrointestinal surgeon and I'm based at Gleneagles Hospital, Singapore. A lot of people get concerned about abdominal pain. In fact, abdominal pain is quite a common symptom that people experience at different times of the day, different periods in their life based on different types of food they eat or whether they're stressed or had a good night's sleep or not. So abdominal pain actually is a very, very common symptom. Most of the time, abdominal pain is really something quite minor, which means that it comes and then it goes and it really doesn't trouble anyone too much. But sometimes abdominal pain can be persistent or quite severe. In those situations, it's probably worthwhile to pay some attention to it and consider whether it's necessary or not to go in and see a doctor. Usually, I will tell people not to worry too much about the pain unless it is severe, meaning that the pain is persistent, it's lasting for sometimes hours and sometimes even days. That's important, and certainly if you've had pain for several weeks, then that should be something you should pay attention to. The intensity of the pain is also useful to take note of. If it's a mild pain and comes and just goes away by itself, then it's probably all right. But if the pain is quite severe, especially if it's cramping or you feel like it's a knife poking pain, that may be a sign of something more sinister. So based on symptom severity, that might be a reason why you might want to go in and see a doctor. The other reason that you might go in to see a doctor is if you have any additional symptoms that may be quite important to investigate. And some of these symptoms include bloating of your tummy, especially if there's been a change of bowel movements or a sensation of nausea or vomiting, particularly after meals. Another important symptom is if you notice that you have blood passing out in your stools, or you're feeling lethargic, or someone told you you're looking pale. The other color to look out for in your skin and eyes is jaundice, which means yellowing of the eyes and the skin. This sometimes happens when the liver is not working well, or if you have stones either in the gallbladder or in the bile ducts itself, which can sometimes get trapped and give rise to buildup of bile in your blood circulation because it's unable to be secreted into the intestine. So turning pale or turning yellow is obviously a very important sign that should be investigated. One more thing that's important is loss of weight, especially unexplained or unintentional loss of weight. If you notice that your weight is going down and you can't quite figure out why, then it's probably worthwhile to go in and have a chat with the doctor. Now, when people come in with abdominal pain, we usually like to be quite thorough. The first things I will ask them is, have you tried any simple measures to relieve the pain? And if so, what has worked? But if the pain truly has been persistent and has not been relieved, or if it's been relieved by, let's say, avoiding certain foods, but then comes back again after that, then we will consider doing a set of investigations. The most basic is actually to do some blood tests. The blood test is looking at the full blood count, looking at the kidney function and the liver function. These are some standard tests that we like to do. Then imaging can be useful. Now when I say imaging, I'm referring to scans like ultrasound scans. That's very safe because there's no radiation with an ultrasound scan. But sometimes if we're more concerned, we would go ahead to order a CT scan or an MRI scan. These give much detailed images. So what are we looking for with scans? Sometimes we can find cysts or swellings in the liver or the pancreas or the kidneys, and sometimes we can find evidence of fatty liver and sometimes gallstones or kidney stones. These are often the cause of quite excruciating pain. Other than that, we often would consider an endoscopy because it's a very good way of evaluating the inside of our gastrointestinal tract. There are two types of endoscopy. There's what we call the upper gastrointestinal endoscopy, which is commonly called a gastroscopy, and there's also what's known as a lower gastrointestinal endoscopy, which is also known as a colonoscopy. Now, endoscopy, as far as doctors go, we consider this a fairly simple and routine procedure. The reason for that is no incisions are involved. It's not actually a surgery. All you need to do is to come into the hospital fasted, and if you're doing a colonoscopy, then you might need to take something to clean out, a laxative to clean out your bowel. And during the procedure, usually we will sedate you so that you are calm and relaxed. The upper GI endoscopy or the gastroscopy usually lasts about 5 to 10 minutes. We will check the esophagus, the stomach, and the duodenum. In the case of a colonoscopy, that usually takes about 10 to 15 minutes to do, sometimes maybe 20 minutes. So taken together, both a gastroscopy and colonoscopy can be done within less than 30 minutes. Again, as I mentioned, we usually sedate everyone so that you are calm and relaxed during the procedure. Now, the risks of doing an endoscopy are extremely small, something like 0.01% chance that you might get some problems such as some bleeding or some pain or injury to the bowel. So endoscopy on the whole can be a very quick and simple way to identify problems within the gastrointestinal tract. So there's no really other way to identify anything inside the gastrointestinal tract. So endoscopy is quite useful for that. Now, when we look inside the gastrointestinal tract, what we can see sometimes, we can see inflammation, gastritis, esophagitis, we can see ulcers, and if we see that, we can take biopsies to see whether these are benign ulcers related to infection or whether they may be cancerous. The real thing that we're looking out for when we're doing endoscopy is actually small tumors or growths. They're often called polyps, you might have heard of that. And polyps usually, when they're picked up at an early stage, are small and they're usually benign. That means they're not cancerous. This is the biggest advantage of doing an endoscopy, because you can pick up polyps at an early stage and prevent their progression onwards towards cancer. So during an endoscopy, if we see a polyp and it's a small one, let's say 3 to 5 millimeters, we can just do a simple biopsy or a small polypectomy to remove the polyp at the same sitting. If we identify any significant or larger lesions, then we usually take a biopsy to identify what exactly the lesion is, and then we will decide together with you how to go forward to treat this lesion. Cancer is actually a very big term because it encompasses a whole range of diseases. Essentially, when someone has cancer, someone has a growth or a tumor that has started to grow uncontrollably and starts to invade tissue surrounding it, and also potentially to metastasize, which means it moves from one location to another. So cancer is worrisome because it cannot be controlled once it has reached this stage. The best way to tackle cancer is actually to go for prevention. And how we can achieve that is picking up precancerous conditions or precancerous growths before they progress to develop cancer. Now you see, cancer requires a whole series of mutations to occur before the cell becomes malignant or cancerous in nature. So a normal cell will not turn malignant overnight. It usually takes months, most of the time years, before cells will turn malignant. So most of the time, cancer will present first as a lump or a growth, or sometimes as an ulcer. So if you notice a lump, for example, a lump in your breast or a lump somewhere in your body, then you may want to keep an eye on that or get it tested to make sure that it's not cancerous growth. And if you feel any abnormal symptoms in your gastrointestinal tract, like a bloated tummy, difficulty to eat, difficulty in swallowing, vomiting after meals, changes in your bowel movements, passage of blood in your stools, or having difficulty in general to open your bowels, you might be concerned about the possibility of having some early lesions going on in your gastrointestinal tract. The best way to pick up these things is actually to do an endoscopy. During endoscopy, we can find small polyps, and these polyps, if they are picked up and removed during endoscopy, we will be able to prevent them from going on to develop into cancer or growing larger and mutating further. So that is a huge advantage of doing endoscopy. The other way that we pick up cancer is also by doing dedicated imaging. So sometimes simple ultrasound or x-rays will be able to pick up cysts and lumps, but oftentimes if there's something we are concerned about, we might do a CT scan or an MRI, and that will give us more detailed information about specific solid organs such as the liver, the kidney and the pancreas. So these are all organs that may be difficult to pick up tumors at an early stage because they rarely have symptoms. So if you notice that something is not going well with your normal bowel movements, your normal eating habits, your daily routine, then it's worthwhile to come in to have a chat with your doctor to find out if something more sinister is going on. Usually I wouldn't worry too much in people who are young, because it's not common to have cancer or serious lesions in your 20s or 30s. It is possible, but it's not common. In Singapore, the recommended age for doing a colonoscopy to evaluate for colorectal cancer is the age of 50. Now, if you have a colonoscopy done at that point and you find that it's negative and there are no important findings, then it's probably not necessary to do another one until maybe 3 to 5 years later, and unless you have new symptoms. Now, what are the symptoms you might want to look out for? Usually symptoms like bloating after meals, changes in bowel movements, noticing blood in your stools, noticing some lethargy, weakness, tiredness. These are all signs that might point towards the possibility of cancer being present. Another important consideration is if any of your family members have had cancer, then it would be worthwhile for you to go for screening, because there would be an increased risk for someone who has a close relative who has had cancer to have cancer themselves. In the abdomen or in the gastrointestinal tract, we are concerned about a few different types of cancer. The main one, of course, as most of you will know about, is colorectal cancer. That's cancer in the colon or the rectum. And the reason why colon and rectal cancer is on the rise is because of changes in our modern diet and lifestyle, where we're eating less of fiber-rich food and eating more highly processed food, which tends to contain more chemicals, preservatives. So these foods then tend to remain in the gut. And the colon and the rectum is the last part of the intestine, and this is the area where the water is reabsorbed from the gut. And so there's more time for contact with these preservatives and chemicals with our mucosal lining, which is the lining of the colon, and causing irritation in the layers, and this is how cancer develops. Now, other than colorectal cancer, there are other important cancers that can occur in the gastrointestinal tract. For example, stomach cancer, pancreas cancer, and liver cancer. These are the three other areas that are very important. Now, fortunately, stomach or gastric cancer can also be picked up by screening endoscopy. Gastroscopy can be done to pick it up. For liver and pancreas, it's not so easy to pick this up because these organs are deep-seated in the abdomen, and usually you would need to do some form of imaging. The simplest test to do is an ultrasound scan, but if there is a strong family history or any concerns, any specific symptoms such as pallor or jaundice, then it might be worthwhile to do a dedicated CT scan or an MRI scan to look at these organs in detail. Many people think that obesity is a cosmetic problem. That could not be further from the truth. In fact, in the last few years, 13 cancers have been identified to be related to obesity. Particularly in women, ovarian, uterine, and breast cancer is very strongly correlated with obesity. What's interesting is that for women, if there is effective weight loss, women who have made attempts to lose weight actually have lower rates of cancer. So not only is obesity related to cancer, people who lose weight have been shown to reduce the risk of getting cancer subsequently. So it is worthwhile to go ahead and change your lifestyle habits and change your dietary habits with a view to reducing your weight so that you can reduce your risk of getting cancer. In men and women, the risk of kidney cancer, thyroid cancer, colon cancer, pancreatic cancer, liver cancer, stomach cancer are also correlated with obesity. Many people think that obesity is a cosmetic problem. Now that couldn't be further from the truth. Obesity has recently been shown to be strongly correlated with not just 1 or 2, but 13 different types of cancer. In women, particularly, it's correlated with breast cancer, ovarian cancer, and uterine cancer. In both men and women, obesity is correlated with a whole variety of cancers, including thyroid cancer, stomach cancer, esophageal cancer, kidney, pancreas, and liver cancer. Obesity is a very important risk factor for many diseases in our modern times. One of the most important things that obesity is correlated with is cancer. In both men and women, the risk of a whole range of cancers increased with obesity.